Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin, where you ask questions about your oral health care, about getting into dental school, about being a dental student, about life after dental school, whether it be residency or working in the profession of dentistry. You ask those questions and we get those answers to you. Please be sure to share and also like and give me comments to each and every episode, especially this one. Subscribe, and I will be posting new episodes every Monday and Thursday. So turn on your notifications when you subscribe on YouTube, my YouTube channel, which is Dr. Darwin Speaks. Today we have another episode of Careers in Dentistry, and we are joined by a superstar dentist. That is an oral maxillofacial surgeon, Dr. Calhoun out of California. Dr. Calhoun, thanks so much for joining us today.
It is my pleasure, Dr. Darwin.
Yes. Thank you so much. So we're going to learn today on how to become an oral maxillofacial surgeon. That's right. That's what we're going to learn. We're going to learn that from Dr. Calhoun today. So, Doc, just tell us a little bit more about yourself. Introduce yourself to us.
Okay, so my name is Colonya Calhoun. I actually grew up in Michigan, went to school of dentistry at the University of Michigan, went to residency at Martin Luther King Hospital in Los Angeles, thought I would go back to Michigan or the South, and fell in love with California, not necessarily the weather either. It was the people and the diversity of people. After being on faculty, I did a PhD at UCLA, and then after that, became a part of Martin Luther King faculty. We transitioned our sponsorship to Harbor UCLA Medical Center, which is in Torrance, California, still serving the same population. About 2014, I became the program director of the Oral Maxillofacial Surgery Program. And then 2 years later, I became the division chief of basically all of dental services for Harbor UCLA Medical Center.
Wow. So sounds like you have a lot of responsibility.
Yes. Did not have that plan. My plan was to do research, be an instructor that everyone loved to go to the OR with, and help someone else develop their vision. But I guess some of my mentors saw some gifts in me and started to pull it out, and it worked out that when it was needed, I was able to step up. So I'm glad.
That's right. Oh, that's great. So explain a little bit about your training. How long is your training to be a oral maxillofacial surgeon?
Well, for me, I chose to attend a 4-year residency training program. And the reason I did that, and I don't think there's a right or wrong, I think you just have to figure out what your path was. I knew I had an interest in academics. And so originally I was focusing on a 6-year program, but after not matching the first time, because I kind of limited my focus to Michigan, I got a lot of great advice from the program that was a 6-year program that I did my internship. And they suggested that I consider a different route, which would be to pursue a 4-year program and also consider pursuing a PhD. And so that's kind of how I got that direction. So my residency program was only 4 years. The good thing about 4-year programs is that you get all of your surgical experience in a concentrated where you don't really necessarily have a break, because a lot of complaints that the 6-year programs residents had was that they had to relearn surgery after they went off to medical school, since a lot of times they were just basically interns running SCUT. Although for me, I still did end up doing something similar with the PhD. So I had the same complaint of, after completing 3 years of residency, I did my PhD, or at least started it my first 2 years, and then I came back and finished up. But the good thing is, it's just like riding a bike. After you've done it, you might take a break and you come back and you're able to step back into that. So my training for oral surgery residency was 4 years. My PhD took a lot longer because I decided to do benchtop research, and you can't just do observational. You have to have some results, and most of the time the results have to be positive. So it took me about 8 years, but I was able to come on as faculty during my last couple of years of my PhD program.
Did you say 8 years for a PhD?
Yeah, but I will tell you, my benchtop work ended I'm in 5 years.
Okay.
One of the things with, I just needed to work. And so after that, I basically accepted the faculty position, put the writing portion on hold. Sometimes when you're when you're doing your PhD, if you're working with someone that is strictly research without a clinical component, they can kind of have a different viewpoint of what your focus should be on. So we had to work on what my thesis really was supposed to look like as far as my PI and myself, because he wasn't a clinician. And so finally we were able to come to some agreement with some mediation with one of my co-mentors who also she's a clinician as well as a researcher. And so kind of 2 years were in limbo. So it wasn't like it took a straight 8 years. It just took some time for me to work and some time for us to work out what I actually would be writing in my thesis.
Right. Because I was just doing the math here. 4 years of undergrad, 4 years of dental school, 4 years of oral surgery training. That's 12 plus off and on the period of time, 8 years for your PhD. And I counted 20. So I was like, wow.
Yeah. Well, a lot of it was concurrent though. The 2 years were during my third year of residency.
Okay. So the additional years, really it's 12 years. The additional years were really for your PhD time and getting together your topic and your thesis, correct?
Yes. Yeah.
So as an oral surgeon, what's your typical day like? And I know you wear many different hats right now in your current role as a program director for oral surgery, and then also as the division and section chief. But typically, what's your typical day like?
So my typical day is we do a fair amount of general anesthetics where we perform small procedures like dental velar implants. And actually, one of my favorite areas is in anesthesia because I love that real combination of medicine and dentistry. And so my typical day is supervising that on a morning. And then in the afternoon, I usually have 1 to 2 scheduled meetings and probably a couple of unscheduled meetings. And that usually is at either the staff level, the division level, or the department level, and in some cases the county level, because as a kind of a group between USC and some of the other county facilities in Los Angeles, the dentists actually have a group where we try to standardize things that we're doing over the county level. And so my typical day is clinic in the morning, and the afternoon is our meetings mostly.
Okay. Now, what are some of the procedures when you're in clinic? What are some of the procedures that you're routinely performing, or maybe not even routinely, just overall, what type of procedures are you doing?
So our routine procedures are obviously extracting teeth. Most of the time they're surgical extractions by the time they get to us from either an outside dentist or even from our own hospital dentist. And we do perform a fair amount of implants, mostly dental, but we also have maybe like 5 to 10% of our implants are maxillofacial implants, whether they're zygomatic implants or implants to retain other prostheses from resections from cancer, from ENT or plastics, or ophthalmology even. And then as far as typical procedures in the OR, for me, my passion is dealing with the unknown. So I like the pathology and the trauma. But we do have a broad scope in our program. We're fortunate that even though I would call us small but mighty, because we don't necessarily have the largest full-time staff, but we have so many committed part-time and volunteer staff. So we do a fair amount of pathology. We do a fair amount of trauma. We do, a lot of trauma, a fair amount of TMJ. And we have started to incorporate more craniofacial because we have 2 faculty that specifically train in craniofacial, which includes, something as small as cleft lip and palate orthodontic surgery, obstructive sleep apnea as well. And then we have added on more recently cosmetics. So we've been able to increase our scope a lot more than the West Coast usually allows because, there's a lot more competition for that cosmetics component. But one of our faculty, we have 2 ways of you being able to practice cosmetics. One of our faculty is dual degree, so they have an MD, and they did a cosmetics fellowship. And then our other oral surgeon actually obtained the cosmetics permit. So as long as you are doing those procedures and they're proctored, you can get a permit to perform them. So we have 2 avenues in which we can perform cosmetics as well. The only thing that we don't do as much of are malignancies, but if they do, it's usually odontogenic in origin or if they don't require neck dissection. So I even have done lip resections for squamous cell, since they don't necessarily spread and require neck dissections. But anything that requires a neck dissection, then we usually just give it to ENT to do.
Okay. Yeah, I got you. All right. Cool. So with those different type of procedures and those, even with your duties and other responsibilities, what are your work hours?
My work hours, well, first of all, if it's above 8 to 10, then it's usually self-imposed, because I'll wake up in the morning thinking of things and getting on the computer. And even sometimes on my day off, I give everybody my cell phone because I just can't help. And I guess it's because it's my passion. I don't feel like I'm working, to be perfectly honest. The only time I feel like I'm working is when I'm problem solving with staff issues or something that somebody didn't email or whatever. But when it comes down to setting that vision, which I think that's what a division chief is that they're setting the vision. And it came from me feeling passionate about what the residents' feedback was as far as their training was concerned, that my hours can range probably on average 10 to 12 hours. And then occasionally I do things, because I feel like I sometimes work 24 hours a day because my brain is always working and I my breaks now. So I do have a day off in addition to the weekends, so that I can, have a regular life as well.
Right. So as an oral surgeon, what's typically the range for salary within the profession? And I know it's maybe a little different for you because you have some other administrative responsibility that may add on to a range of a salary. What's typically the range for most oral surgeons?
So I would separate it from academics and private practice. The range for academics is 150,000 to maybe 450-ish. And that kind of depends on what kind of faculty practice. So for me in a county facility, ours is on that lower end because we don't currently have a faculty practice, but that is actually something that our alumni are working on right now so that we can be more competitive. But frankly, most places don't necessarily have a high starting faculty practice when you first come in. So the range is probably 100 to 250 for that initial faculty position. Outside, it's so much more. It's usually above 500,000. Most of my residents come out making, doing really well in their first year. I think that the trend is moving from a solo practice, or even a group practice to more of independent contracting, especially out in the California area. We used to frown upon independent contracting because then you really did not have a specific facility that you could ensure that everything is up to standard. But I think that has changed so much since that's becoming more prevalent. And basically, oral surgeons are trying to take back what corporate dentistry has tended to be, where it's a business and you have non-dentists and non-oral surgeons telling you what you need to do. And now the oral surgeons are kind of taking that back. And so they're kind of making it where it's not necessarily working for a specific organization, but that you work with local dentists and build those relationships so that you can go to their offices and don't necessarily buy your practice. So I have a couple of faculty members that want to come on full time, and they're having a hard time selling their practice because it's changed so much, at least out on the West Coast, where no one wants to buy a practice, or not that many people, I should say.
Yeah, and I think that trend is happening in other specialties like endodontics.
Yes.
Where a lot of practitioners are finding it just as lucrative, maybe not even having their own practice, but actually being an independent contractor where they are traveling, so to speak, and they have
exactly
a traveling bag of surgery and tips and advice.
Right.
Well, I mean, everything is just right there, and they travel. So I think it's interesting to hear that trend is also kind of drifting into oral surgery as well.
Even where they're traveling with their meds and all that stuff. It's like, that's a lot of things, and emergency equipment traveling.
Yeah, it is. Like concierge oral surgeon. I mean, you have in the back of your van, you got everything.
Pretty much.
Right? I mean, everything's right there. So question, knowing what you know now, it's been about 20 years, you've been practicing, training, and everything. Knowing what you know now, what would you do differently, if anything?
I think I would have accepted more feedback, even if it didn't come in the package that I would have liked. I would say I was pretty good at trying to make lemonade out of lemons, but but sometimes I wanted to fly beneath the radar rather than just really accepting the criticisms that I got from my attending staff, and even accepting things that I didn't necessarily agree with, at least consider it. And so that's one of the things I encourage my residents, because I was a little on the hard head side, I won't lie. And I think part of that is the surgeon's mentality of thinking you're a person. But a lot of things, even when my chairman used to tell me all the time, you're going to be a director one day, you're going to be a chair. And I was like, yeah. And I think if I had accepted some of those observations and at least considered them earlier on, I probably would have been program director maybe 6 years ago, because I was already doing everything, but I just stayed focused on actually accepting that because I had another plan for my life. And then I probably would have been chairman earlier. And even though I'm still relatively young for having both those positions, I would have been in at least one of those for maybe 5 to 10 years before, a lot earlier, if I had listened to that feedback sooner.
So listening to feedback and maybe doing some more reflection at the time, maybe. I don't know.
Yes.
Good.
No, that's not what I want.
Exactly. Well, that leads me into the next question as far as advice. What advice do you have for people who are aspiring dentists, and whether they're in school now or they're applying to school, and they know, or they have a feeling that maybe they want to become an oral surgeon? What advice would you give them?
I would say, first of all, and I think that comes back to what I said, is a self-awareness. There is a book that I've read, but I've lived my life that way, even though I didn't know there was a book that described it. And it's called Grit by Angela Duckworth. And not letting someone else's restrictions direct you. So even though it's good to, I think there's a proverb that says, in the multitude of counsel, there's safety. And I think it's important to have counsel, but in the end, you have to know who you are and you have to be driven by that. And the reason I say that is I was discouraged from pursuing sciences in junior high. The instructor said, well, you can sing. Why would you want to be a dentist? And I had to ignore that because I knew what was in me to, pursue dentistry. When I was in college, I did have more encouragement then, but as soon as I got to dental school, the first thing that most of my instructors would say is, how do you know you're going to get into oral surgery? Because I had DDS already on my license plate before I got into dental school, which they thought that was arrogant, but it was my way of speaking I basically speaking myself into a position that I knew I was going to do. Whether I was 100 years old by the time I was able to achieve it, it was, in my mind, it was going to happen.
Right.
If you have that kind of grit, recognizing your weaknesses. So I didn't say I was going to be an oral surgeon and I didn't have to study. And even though I was in the top 10, I knew my stuff. And so classmates would be like, well, how is it that you're not in the top 10? Because as far as they're concerned, I was the one answering all the questions. I just hadn't gotten good at taking multiple choice tests, which then reflected in my scores.
Right.
But I was driven enough that I wouldn't let anything stop me. And so I think if you know yourself and that you pursue passionately what you feel like you're called to do, always still being open to mentorship and direction, but never letting somebody kill your dream. And then doing what you need to do to get there. So you can't just say, I want to be an oral surgeon, I'm passionate, I'll take out a lot of teeth, because that may not be your weakness. Your weakness might be academic. So sit down and study. And if that means study 8 hours in the evening, then that's what you have to do. And that's basically what I had to do. I wasn't going to just wake up and know everything, because that was just not how I learned.
Right. So put it out there, speak it into existence, and then get it done by any means necessary. That's what it sounds like.
Pretty much.
What was the name of the book again that you mentioned?
It's called Grit, Grit.
Okay.
By Angela Duckworth. And actually, one of my residents who we like to choose unconventional residents, and it was clear when I spoke to him the first time on interview that he was not going to pursue oral surgery as his love of his life in and of itself, but it was clear that he had a vision in using that for something more.
Right.
And so we thought he would bring something different to the table for our program. Was one of the best surgeons, one of the best instructors, even though he could do without most of the surgery except for implants and sedation, because that was a form of revenue for him to do some other broad scope and global medical things. And so, but because of that, and I say that just because I think that we put ourselves in such a box, and we should kind of be open to opportunities that avail itself.
Mm-hmm.
And he taught me more, I think, than I probably taught him, even though he was my resident. And that was one of the books that he was like, this is what describes what you believe. And maybe this is how you have to look at residents and how you even accept residents, that it's not just grades, it's grit. I think grit, she describes that really well, that persistence, pays off more than talent.
Wow. I love it. I love it. All right. So look, this gets me to the last couple of questions. And these are these four questions we ask everybody. 4 questions we ask everyone on the episode. All right. So question number 1, what's your favorite day of the week?
Friday.
All right.
You want to know why? It is not because it's the end of the week. We have our didactics. And as you can tell, I like to talk. But I love the dialogue that we have about going over cases and it being a less stressful environment than being in the OR or being in the clinic and doing procedures, but just really tying all that together. Right. And then also, you're winding down too. And so you can kind of think about what you're doing on the weekend, because I do like to get in my residents' head. And I say I'm the grandmother of all of their children, and I've babysat their kids. So I like Fridays because that sets me up for my weekend.
Gotcha. Okay, so Fridays. We got to vote for Friday. What's your favorite food? My favorite food.
I didn't think. Seafood.
Well, that's good. You're in LA. You're by the water too, so that's
right.
Perfect for you. All right. What's your favorite procedure or task that you do?
Well, can I have 2 answers for that?
Of course.
Okay. Surgically, I love pathology. I love dealing with the unknown, getting around structures and vessels, and not necessarily having it just, where I know I'm going to move something 3 millimeters like you would with the orthodontic surgery. And then outside of that, really strategic planning. I mean, that is when I feel most alive. I feel like I'm the puppet master. Or at least that's what I enjoy doing, is moving chess pieces. Okay, so I need to do this to get this, and this is where we need to go to get this. And so I didn't realize how much I love that, but I do love that as well.
Nice. Strategic planning.
Yes.
Awesome. Okay. And what's your favorite activity outside of work?
Okay, so home improvement, because contractors are shysty. Well, let's put it this way. I'd like to know what I'm asking someone else to do, so then I end up learning how to do it myself.
Right.
And singing, I still do some singing. Mentoring, because I think I like to mentor in all areas. So whether it's singing, or whether it's surgery, whether it's administrative, I love mentoring my dental assistants, because some of them have a lot of extra talents, and it'd be easy for me to just keep them into my dental clinic if they're really good dental assistants. But if I see something else in them, one finished her PhD in psychology, because it was clear that she was a great dental assistant. She needed to do something where she had more control over her career and her future and her life. So I love mentoring in all aspects, whatever that is.
Okay, I got you. Oh, awesome. All right, so look, any projects? You have any projects that you're currently working on that you want to share with us?
Well, we're looking to expand our services, and it's far, and this is a personal project. Again, because trying to be the best little program in the country is a task, because people assume, just because you're 4 years and you only take 2 residents, you don't need to do all that. But some of the things we're trying to do is build a better CE program. And part of that for me is an online review course, as well as a faculty practice, which I'm working with some of the alumni who are trying to either donate a physical building, because, when you're working in an underserved area, you don't necessarily have a thriving private practice, because it's going to be the same patients. And so we're trying to find a way to do both, and also provide opportunity for the residents to do some moonlighting if they're in good standing. So those are my projects. And then hiring some purple surgeons, like specifically someone that can assist me being a program director, and if not being one, which we're working on that now, so that I can do some more research, because I don't want to waste my PhD, because I loved basic science research, and I think that oral surgeons, one of the things that I admire about periodontists is that they are very involved in in research, probably more than all the other specialties combined. And I think the only way for us to stay relevant is that we replace ourselves, because we're the ones that are actually innovating. And so that's why I want to get back into research. And I haven't, I was doing some corneal research, and still hopefully will, where we're taking mucosal cells and using it for corneal transplants.
Oh, wow.
With ophthalmologists. So, but that's in its early stages for my involvement, because I was not involved in as much earlier.
Gotcha. Wow. So it sounds like you got some real great, interesting projects going on. One of your favorites, mentoring, we're actually going to be having you this summer as a panelist to one of the SNDA New Dentist panel. And you'll get a chance to, I'm sure, reach out to several dental students that are interested in becoming oral surgeons, and you'll be one of the, if not the first or second, networking contacts for them to serve as a future mentor. So that'll be great. I'm so glad we're going to be working together this summer at the SNDA New Dentist panel, SNDA NDA New Dentist panel.
Right. I'm excited.
Yeah, it's going to be a good time. And you're going to be celebrating a birthday too, I remember. Are you celebrating?
Huh? That you don't need to remind me. Oh.
So look, Dr. Calhoun, how can people get in contact with you? They have questions, whether it's about your program, about becoming an oral surgeon. I mean, just women in dentistry, like what? How can people get in contact with you?
So the best way to contact me is through email, and my email is ccalhoun at D as in dog, H as in Harry, S as in Sam, .lacounty.gov. You can also check out my website, because the website also, I think, still links my email in case you are unable to reach me or forget the email. And the easiest way to do that is just to Google my name. So Google Colonya, colony plus an A, Calhoun. And if you put DDS PhD, the Harbor UCLA website pops up. So even if you're interested in hospital dentistry, you can get through that link to look at our faculty, look at our education, including what we recommend for the residents, as well as looking at our alumni information, because we do have alumni newsletter that comes out every 2-ish years or so, since I'm the one that does it. So it's slowed down a little bit till I finish electing a editor-in-chief other than myself.
That's right.
But give you a flavor of our program and what we are all about.
Nice. Hey, thank you so much for joining us today. I appreciate your time. I know you're busy. Probably got 4 or 5 things going off on the side of your head at the same time, but I appreciate you sharing this particular career in dentistry and your specialty area and what you do. So thanks so much, Doc. I appreciate you.
My pleasure.
And if you out there, if you guys have questions or if you want to hear topics more specific that you want us to bring on, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And be sure to subscribe and share this, and also give me some feedback. Give us some comments. We love to hear your feedback and see how we're doing and how you like today's episode. So again, Dr. Calhoun, thank you so much, and we'll see you soon. Thanks.
Okay.
All right. Thanks.